Welcome back to This is Menopause, where we talk all things perimenopause, menopause, and no topic is off limits. I'm Dr. Christie Guepet.
And I'm Dr. McCool Pearson, and today we're having a conversation about the physical changes that affect healthy intimacy, sexual activity, your sex life. So the tissue changes that occur when the hormones drop.
Welcome to This is Menopause, where together we explore the marvelous and yes, sometimes treacherous journey of menopause and that mysterious detour perimenopause. We're here to rewrite these chapters to change her story.
So we talked a little bit in our previous podcast about, kind of the I guess the mental things or the intimacy itself separate from the physical changes that occur with intimacy when we age and when we get perimenopausal and menopausal. So let's talk a little about that.
Yeah, so many women suffer in silence with these issues, with these physical changes. They think that they're alone. They don't realize that there are treatments available to help. It's just so hard to talk about this very personal symptom and pain that women are experiencing can truly be life-altering pain and interfering with their relationship with their spouse, as well as just how they feel about themselves in general. So let's start with talking about our favorite option for this, and that's really vaginal hormones.
Vaginal estrogen. So they actually named it. We were taught it was atrophic vaginitis or genital atrophy. So genitourinary syndrome of menopause actually has a name now. So that those changes that occur in the vagina, in the vulva, and in the bladder itself actually have a name. And so what you're feeling, we've talked traditionally in the past, women thought, okay, hot flashes, that's my menopause, but nobody really talked about the vagina. So vaginal estrogen is very safe. We even use it now in our breast cancer patients. The North American Menopause Society, which is now just the Menopause Society, has actually made a statement in the recent years about the safety of vaginal estrogen because it doesn't raise systemic levels to any significance at all. So that is a very safe thing to do. That's usually the first line treatment. I mean, vaginal hormones and estrogen being the main one. There's some other options too.
Right. Vaginal hormones can also, in addition to helping painful sex, can also help urethral and bladder symptoms as well. So along with painful sex, women oftentimes with age develop more urinary frequency, urinary urgency, nighttime urination, more frequent urinary tract infections. Our urethra when we're younger is about 4 centimeters in length, and as we get older, that urethra gets shorter and shorter. That means that it's a shorter distance for bacteria to travel from the outside of the body to the inside of the body. So vaginal estrogen can help that tissue be more robust and
healthy. And also healthy. The microbiome, which is the normal bacteria that live in that area, changes when estrogen goes away because the pH changes. And so vaginal estrogen helps keep that microbiome as it should be. So there's kind of two ways that it makes the tissue more healthy, and the microbiome is where it's supposed to be so that we don't get bladder infections. So it's not just
it
about
decreases yeast infections and bacterial vaginosis as well, but because it normalizes the pH.
Yes.
And makes the tissue more comfortable.
Yeah, so it's not just about not having painful sex, it's about those other things as well.
So the formulations of vaginal estrogen, which are usually the first line, are vaginal estrogen in the form of Premarin and vaginal estradiol. Those are creams that you use nightly, and then for 2 weeks to start with, and then twice a week after that. There's another vaginal tablet called Vagifem, which similarly is every night for 2 weeks, and then twice a week after that. Long-term compliance is not great with vaginal estrogen because it is not convenient to administer a medicine in the vagina.
No, it's
often
not comfortable sometimes. It makes it greasy.
Right.
Yeah.
So that's the reason it's nice that we have a tablet, we have a suppository, we have a cream for. So some women have a chalky discharge, with the tablet, so they prefer the suppository, and some women welcome the moisture of a cream, and some women feel like it's too much. So it's good that we have a lot of options for that, but even with all those options, compliance is not great.
No.
And my favorite option is a vaginal ring. You know, that ring stays in place for 3 months, is out of sight, out of mind. Once you go to bed at night, you don't have to get up and out of bed, but it's not available in generic. So it sometimes is prohibitively expensive.
Yeah.
There's also a suppository that is nightly. It is called Interosa. It is an estrogen-like hormone, and it is a little bit more convenient for some women who think it's easier to get in the rhythm of once every 24 hours versus a couple of times a week.
Yeah, and then I tell my patients too, sometimes if you feel like you get to the point where it's really helping, you may be able to go every other night, but it is prescribed nightly. So, and like I said, even, you can't really overdose on vaginal estrogen, and so the fear, for any patient, whether she had a history or a strong family history of breast cancer or not, it's just, we need to make sure that that's a public service announcement for us, is it is safe.
Yes.
Vaginal estrogen is very safe.
To the point, a lot of us argue it should be over the counter.
Yes.
So, you know, there's one exception. If someone is overdosing themselves with cream, so they are just using an excessive amount of cream, it is possible that the lining of the uterus could thicken, but
It takes a lot.
it would take a lot.
A lot.
But you know, the argument is people can overdose on Tylenol, and it's over the counter.
That's true. They sure can.
And that puts people in liver failure. So vaginal estrogen is very safe, and we think every woman, as soon as you start having any of these symptoms, should
may
talk
start
to
in
a
the
doctor.
40s.
Yeah, absolutely.
And then, so we kind of went through all the different options for the vagina, but there's also systemic options too. And many of our patients that are on, you know, systemic means something that's either taken by mouth, applied to the skin, injected under the skin or into the muscle, anything that's absorbed into the bloodstream is systemic. And so many of our patients that are on systemic hormone replacement therapy in the form of estrogen and or testosterone will still need some vaginal estrogen, because I tell patients that just because you're on systemic hormones does not mean that enough of that hormone gets to the end organ, which is the vagina in this case. And so many patients think they have to be on one or the other, or they can't be on both, but you can. You can be on systemic hormones and still need vaginal hormones.
I encourage women to do both for that reason. You know, systemic hormones can help with more systemic problems: hot flashes, night sweats, sleep, emotional lability, and all of those things are important for sex.
Absolutely.
If you don't feel well because your body isn't functioning well, then you're not going to be interested in expending additional energy, particularly if it's painful. So systemic hormone replacement can help optimize the function of the entire body so that sex can be more comfortable and enjoyable.
Absolutely. So let's talk a little bit about the role of testosterone as a female hormone. So I even had a patient this morning, she goes, wait a minute, that's a male hormone. It's not a male hormone. So that's another public service announcement we want to make, is that you have more testosterone than you have estrogen in your reproductive years, and it needs to be replaced because there are things that testosterone receptors are responsible for different than what estrogen receptors are responsible for.
Energy, motivation, brain fog, exercise
Sense of
endurance.
well-being.
Yes. Confidence.
Yeah.
And libido.
And libido. And
Right.
libido. And so, you know, we talk about, I have patients that say, okay, well, I need you to give me even more testosterone because my libido is not where it should be. And that's always a bit of a red flag for me, because I want to think, okay, wait a minute, are we talking about sex drive? Are we talking about libido? Are we talking about intimacy? You know, I can give you enough testosterone to really make you want to have sex, but if there's other problems, we don't need to do that because of side effects. So what's the side effects of too much testosterone? Clitoral enlargement, hoarsening of the voice, to the point you can even get an Adam's apple. You know, hair growth and acne, you know, hair growing in places you don't want it to be, or losing hair in places you do want it to be, like on your head. Those are side effects that we have to be cautious about. And so just because a patient says, well, it's not working well enough for me, we have to kind of, take a step back and say, okay, let's talk about what's really going on here. Because if I give you too much testosterone, then this is what the side effect is. Not only do you get clitoromegaly, sometimes the clitoris stops working. You can't even have an orgasm if you've overdosed, so to speak, those receptors and they're saturated.
You know, this is where the choice of provider is so important. You have to have a provider that has restraint and has the appropriate level of respect for testosterone and its power to potentially do harm when overdone. As you mentioned, I mean, testosterone can be used to override the red flags that your psyche may have about a relationship. And I joke with my patients all the time that a house can be burning down behind a family, and a husband, as long as he knows his people are okay, might be interested in having sex. A woman is worried about rebuilding her nest, and that's because likely God created us very intentionally in a different way, and so their levels of testosterone can override those things that God needs women to be attending to.
And we don't want to override a red flag like an intimacy issue or a relationship issue because we're going to throw more testosterone on the fire. So that's like you said.
Because testosterone has the power to do that.
It does.
It has the power to create hypersexuality,
mania. It can make
full out manic episodes. And in the U.S., we don't have FDA approved formulations for women.
No.
And that means that when we are prescribing for women, we have to think outside the box of the FDA, and so the one thing that we are proponents for, even though it is an imperfect science, we are proponents for doing level checking, and that allows us to do two things: to look at a number and to sit down with the patient to try to assess if the patient is having any of those side effects, and to make sure that a level doesn't show super physiologic amounts of testosterone in their body. So it just needs to be done very carefully and cautiously.
And the other thing that I didn't even think about a minute ago, we were talking about the side effects. You know, your blood can become too thick too. So, and that's increased your risk for things like stroke, scary things. So it is not something that can be taken for granted. It is not something that you can just, throw more testosterone to the patient. You have to really be cautious about that, and checking levels is important, for sure.
I mean, I think that's true with anything that makes you feel good. So testosterone can make you feel good, and if a lot of people think if a little bit's good, a lot's going to be better. Be careful and find a responsible and cautious provider for that.
And what about the other things that we offer that can help improve the quality of that tissue and the tissue response sexually? So platelet-rich plasma, the O-shot, radio frequency energy is used to improve the quality of the tissue down there. It brings in more nerves, more blood vessels, and just improves the overall health of that tissue. We use that in addition to using vaginal hormones because you want to optimize that tissue to the best that you can before you start using some of these other modalities.
But a decline in sexual response and a longer duration to reach orgasm is just another reason for a woman to add to the list of, I don't want to have sex.
Right.
So if we can make the experience more favorable by improving blood flow, improving nerve function, and shortening the window that it takes to reach orgasm, then a woman's going to be more interested in having sex.
Yeah, especially if it was, dry or painful to begin with. This is the last thing you want to do is for it to take even longer.
Our studies have long shown that exercise improves interest in sex, increasing the frequency and variety of sex. If people are having sex in the same position, in the same bed, at the same time of day, for decades, there will be less interest about it. But if women think outside the box and do things in more of a fun and adventuresome way, the next day they're going to be like, I did that. and they're going to think about it more. And the more they think about it, the more interested they're going to be in it. So those are, you know, non-prescription, non-procedural things that our studies show help.
Because it is a mindset. You have to have your mindset in the right spot. Regardless of all these physical changes, you have to make sure that it appears is functioning as well.
Physical therapy, so pelvic floor physical therapy can help with a type of painful intercourse called pelvic floor dysfunction. The floor of the pelvis is kind of like a hammock, and some women end up with almost like Charlie horses in that hammock, and they can't help but, you know, tense those muscles. And over time, just like a bodybuilder that builds and contracts their biceps over and over, that muscle gets larger. Well, those women who are contracting that pelvic floor can develop like a shelf, and this constant spasm. So pelvic floor physical therapy can help us to help those women relax those muscles as well.
Yeah, especially the ones that have had sex with pain for so long, they can develop that as a response. And so then you have to make sure that you address that as well, because, you know, there's so many things that can contribute to the I don't want to have sex.
Right.
So we talked about, you know, the no FDA approved, but how no FDA approved testosterone options for our patients here, and how we have to think outside the box, but how life-changing testosterone can be and how important it is. I think it's something that we want to make sure that we send that message, that it's not a male hormone. It's not just for libido. There are other things that it does, and the increase in your improvement in your mood and your sleep, along with your bone health, you know, are some of the other reasons that it's so important.
And when you feel like your body is working well and not starting to, you know, fall apart or working against you, it not only impacts your relationship with your spouse, it impacts how you interact with the entire world, because it impacts confidence, and so it's an important part of a woman's life, and it's been something that's been very hard to talk about for a long time, and we're ready to talk.
We're ready to talk, and we're ready to answer your questions. So
Follow
just
along.
follow along. This is Menopause.
You make me